If you have arthritis in your knees, and let's assume here for this, you have arthritis on one side of your knee. So let's say this is your right knee and you have arthritis on the inside of your right knee where the joint has collapsed on that inside and not the outside, or the outside and not the inside. Meaning if both have collapsed, what I'm going to show you is not going to help. But if one side is collapsing, this type of knee brace might give you significant relief. This is called an unloading knee brace, and it has a hinge here and an adjustment screw here or here, and that it helps push the knee in or out. So what it does, if that joint has collapsed, it actually helps push the knee back like this, taking some pressure off of the part of the knee that is degenerated. Now, again, if the whole knee, the inside and the outside, is degenerated, this type of knee brace is probably not going to give you a lot of relief. But if one part of your knee, the inside or the outside, is degenerated, this can be adjusted to push inside or outside. It bends in order to give someone relief. It's called an unloading knee brace. Another type of knee brace is basically just this type of supported knee brace with some hinges in them to provide some support. That could be helpful if somebody has a meniscus tear, if they have a medial collateral ligament strain, an anterior posterior cruciate ligament strain, maybe a partial tear. This type of brace is not going to be great for a full tear or anything. Oh, it could be good during recovery. Anyway, there's lots of different situations where different braces can do different things. I just want to let you know that if you have osteoarthritis of the knee and part of the joint is collapsing or is degenerated, an unloading knee brace can be very helpful at giving you some relief when you're up and about and walking around. I'm always shocked when people say they come in and they've got arthritis in their knees and nobody's ever suggested any bracing to try to give them some relief. And that usually shocks me a bit. It gets me a little jaded on the system. It makes me think that the doctors that they're seeing only want to do a surgery. And I like to think better of the providers out there, but that's how I think. It's hard to think differently when you've been on this side of things for so long, trying to help people without drugs and surgery. Anyway, leave me some comments below. I'm Dr. Dave Morris of Magnolia Medical Center here in Murfreesboro, Tennessee. Take care today.